welcome to Bronx Talk. Tonight we're thrilled to be joined by Bronx Borough President Vanessa Gibson. She had been on Bronx Talk more than a year ago talking about the imperative to improve maternal care in the Bronx. More recently, she issued a full report on the subject, and we're going to review that with her tonight. We'll also talk about a range of other issues. Let's get right to it. Please join me in welcoming the Borough President of the Bronx, the Honorable Vanessa Gibson. Nice always to have you on the program.
Thank you. Good to be back again.
Let's just talk about, now let's see, I looked it up, May of 2023, you were here with data released from a maternal health committee that showed a huge racial disparity in maternal health outcomes in New York City. In the Bronx in particular, we'll give the number very quickly. The mortality rate is far higher than the rest of the city, and with CDC numbers showing that black women are more than 3 times likely to die of pregnancy-related causes. You have taken this, and you've been, as far as I could see, the leader in New York City about doing this. Just talk about, number one, the importance, and then we'll talk about the report you released and where you'd like to go with it.
The importance is that this is a call to action and attention, and it's simply a healthcare crisis. Black and Latino women are more likely to die because of pregnancy-related complications during childbirth, and that's unacceptable to me and many of my fellow Bronxites. Bronx mothers cannot and should not wait when it comes to birth workers, doulas, and midwives, and patient-centered care in a very holistic way. And we believe that birthing centers, Bronx-based birthing centers, absolutely can do the work to support mothers on their journey of pregnancy so they can have prenatal and postnatal care, wraparound services, and they can deliver healthy babies and not die during the process.
I've got to ask you, why is there a discrepancy in ethnicity? Why, I mean, I just quoted, there are many numbers in your report, has a lot of those numbers. Why do black women have worse outcomes? It's unfair. We'll start there. But why do you think that is?
It's been going on for quite some time, Gary, and I often say that it is a part of systemic racism. It's healthcare inequity when it comes to prenatal and postnatal care and giving black women all of the services that other women are afforded, insurance, how they pay for services, transportation, social determinants of health, some of the hereditary issues that black women face. All of that is relevant in this conversation and why there are persistent barriers that just are in the way of women getting the full range of services, prenatal and postnatal.
I remember going to a prospective mothers forum and fair at North Central Bronx Hospital. I've been around a while. They have made over decades a real effort at this. Do other hospitals do not get it? I mean, it's disturbing because we could, and the health technology is there. Is it a matter of care about it? Is it a matter of funding? I mean, I don't want to list all, healthcare, of course, as you know, is our largest industry.
Yes, it is.
Why have we missed the boat here? It's just upsetting to me and to everybody.
Well, during our research and building out the birthing report, we talked to a lot of healthcare professionals, specifically black nurses and CNAs and many in the healthcare sector. We talked to birth workers, doulas, and midwives. We also did research on the first ever birthing center in the city of New York, which was the Childbearing Center of Morris Heights in the Bronx that opened in 1988. And a lot of the industry has talked about changes in healthcare, where you often feel that it's profit over people instead of people that really matter, and focusing on what black women need, our very unique needs when it comes to healthcare, when it comes to the delivery of healthcare. And I think it's a lot of those factors, as well as the availability of what doulas do. That's why we're working to build out a doula directory with the New York State Department of Health. That is why we worked with Governor Kathy Hochul last year to make sure that Medicaid covers prenatal and postnatal care. Because if you are underinsured or lack insurance, it's hard to access these services because you cannot pay for them through private insurance because you may not have that, right? And so what we're trying to do, Gary, is level the playing field. We're trying to make it equitable across the board, saying regardless of who you are, regardless of your ability to pay, but these are services that you should be afforded and entitled to.
You know, the whole notion of birthing centers, I was really surprised, and frankly, I learned it from you, probably when you were here, more than a year ago. There aren't birthing centers in New York City. There's one right in Brooklyn, and one of your agendas and one of the main agendas of your report is the fact that we need to have one in the Bronx. Frankly, I don't represent the other boroughs, but there's no reason we can't have them in Queens and Staten Island and Manhattan as well. But let's talk about our home borough of the Bronx. We need one, right?
Yes, we do.
And why? And what would it do that we don't have already?
So number one, a Bronx-based birthing center would provide a level of consistent care. It would provide continuity. It would provide patient-centered care. There will be acupuncture, group therapy, individual sessions, really attending to the needs of women and their families as well, in a way where they feel most comfortable. Sometimes when you're seeing doctors in a hospital setting, it feels very rushed. Because it's by appointment, it's based on time. And, again, the volume of a lot of our doctors, it's enormous. We are working closely with hospital providers and many of our partners in the Black maternal health world and that space. Birthing centers are highly regulated. There are insurance requirements. There are a lot of regulations that you have to go through, and that's one of the challenges of why we only have two, one in Buffalo and one in Brooklyn. But there's a lot of appetite. We've talked to birth workers and doulas. We've obviously talked to many of the families that are affected by maternal mortality and morbidity, where they've lost a loved one, like Bruce McIntyre from Amber Rose, and making sure that he is a credible messenger at the table because he lost his beloved wife and is now raising their child by himself, right? And so the pain, recognizing that and turning it into purpose and really building out a center. I will acknowledge that we have a reproductive wellness hub today called Miriam Clinic in Norwood. It's on the backdrop of North Central Bronx, and it's run by birth workers and doulas and midwives. And shout out to Myla Flores and Bruce McIntyre and Dr. Carla Williams. It's a beautiful space, and that is our beginning process of building out a birthing center.
I have to congratulate you on the report, because not only did you study all these issues, and we're going to talk, I am going to break down some of the things that are going to be needed when we do put and I say when, not if, when we do put a birthing center in the Bronx. But the other thing that the report had was definitions of things that people, listen, it's clear I'm a man and I, don't, automatically know a lot of the things. I just thought it was very interesting to talk about doulas and midwives and what the difference was. Just talk a little bit about that and your thought process in putting that out in the report, in addition to all the agenda items that you were interested in.
Right. So our report is as extensive as can be. A lot of the delay in just releasing it from the initial announcement was data and research and a lot of follow-up, right, and getting information to compile a real comprehensive report. And every report that we've done as an office, whether it's housing or it's healthcare, we always start out with definitions, because in this space of the birthing justice world, there are terms that you don't understand. What's a birth worker, a doula, a midwife, prenatal, postnatal care, acupuncture. So we've described everything in very delicate detail in a balanced way so that you understand the different certifications that a lot of health professionals are held to. And so what we also outlined was a lot of the data, right? How do you define, not just the professionals, but also some of the data that we're looking at. And everything that we've done in this report, Gary, is to justify our reasoning and our blueprint on why a Bronx-based birthing center is so essential. We're not trying to take away from the work that hospitals do, but what we are saying is that birthing centers are different. And even experiencing in our office, our deputy borough president gave birth and has a beautiful daughter and worked with a Black doula, right? Because she wanted to potentially have a home birth versus a hospital birth. One of our elected officials, Councilmember Pierina Sanchez, also worked with a doula. And so there are many examples of doulas' success, and they often are not a part of the conversation. And through this report, we have included them and made sure they had a seat at the table.
You just coined a term that I have never heard before, and I'm wondering
What did I
maybe
say?
if it can continue the birthing justice world.
Oh, yes.
I'd never heard that put together before, but that's really the way you look at this, that much like all the other things about equality and justice that we
Yes.
do, this is something that has not ever been
Yes.
presented in this way.
Yes.
So congratulations
Thank you.
make a note that on Bronx Talk, in March of 2025, that we heard that for the first time. One of the things about establishing a birthing center in New York State, which is a complex and rigorous process, we understand that, and I had never heard this before. The biggest challenge is the certificate of need, and and it's called CON.
Yep.
You talked about that in the report. Talk about this, why it's a challenge, a certificate of need. To me, this conversation has already established the need.
Exactly.
We just take a transcript and we could show it to them. But why is that a challenge, and why is that one of the issues that you got to get across
Pass,
the finish
right.
line?
So a part of our research was obviously looking at what the regulations are through the New York State Department of Health and figuring out where there are gaps in service and then regulations that absolutely have to be done. The certificate of need is obviously a document, an application that you submit to DOH, and it outlines your reasonings, your logic, your data, your justification, your blueprint, your vision, your principles, your value, everything that you want to achieve in mandating the services that you think are very important. And just like any other application, if you're responding to an RFP for housing or any other project, to me, it is a symbol of what you hope to achieve. And obviously, it's a competitive process. But for me, it is making sure that our healthcare professionals and officials in Albany understand why this is a problem in the Bronx. And respectfully, not assuming that everyone knows what we face in the Bronx, but the certificate of need are the voices of the people that are impacted by the inequities that we have experienced in the Bronx. And so that to me is why, certificate of need is so important and why we had to outline it and define it in the report.
And who puts that together? Is that something that, for example, it comes out of the borough president's office, or a developer who is, maybe building something out, or an organization that's going to sponsor it? Who creates that certificate?
Right. So the certificate of need would be the actual applicant. If it's a non-for-profit, the organization that is seeking the approval of DOH
So they would
to
put it
open.
out.
Correct.
I want to get the vision of what this looks like. And one of
Okay.
the things, and we've done this on BronxTalk for a very long time, one of the things that I think is very important to do is help the people of the Bronx, including me, visualize what we can do and what we can do better. So small community-based practice, something that gets attached to a hospital. We're looking for a space, in an apartment building, and it becomes the first floor of the building. How do you visualize, or is it like we find an empty lot and we build we build a structure of some kind? How do you visualize, and what would be the best circumstance to do this? Let's visualize it, and then maybe in the long run it can happen.
Right. So I will acknowledge that my Health and Human Services team, during the research process, we did identify and look at the Buffalo site as well as the site in Brooklyn. So we got visuals to understand what it looked like. The Miriam Clinic in Norwood is a great example of what we want to achieve as we move forward. And number one, it feels so comfortable. The setting is beautiful. It smells great, right? Which is a good thing.
You want, obviously,
you want to
through
feel
this
comfortable.
process, you want women to feel comfortable.
Absolutely.
And their husbands.
Yes, that's right. So the Miriam Clinic is small. It is on the ground level of a house in Norwood, so a very residential area around North Central, close proximity to a hospital in the event that there would be a hospital birth. But there are acupuncture rooms, very small settings where you can have one-on-one sessions with your patient. There are opportunities to have like group sessions as well. So what Miriam Clinic does is brings the patients together and they all talk in circles, like a circle of sisters, of women that are all expecting, and they talk about some of the challenges they're facing. What can we do to help you, right? Through this journey. It's a lot.
You can keep going, but that just sounds wonderful. The fact that women would get together, share experiences, share concerns with experts around them to help guide them. I just love that. Go ahead. You can continue on.
It's beautiful. beautiful. So this space, again, it's decorated in a way that feels very warm and very welcoming and very inviting, right? And what I love about the birthing center approach is that it's centered towards the patient, towards the woman, right? And that's a very unique thing, because when you go into larger settings, you feel like you're one of many, and you're not very individualized when it comes to your level of care. And respectfully, again, understanding that in the healthcare world, you have hospitals and healthcare centers that do a tremendous amount of work, but many are overwhelmed. They're underfunded. They need more opportunities. So to me, the birthing center is a very warm, comfortable space where you can be yourself. You're not at a time limit where you have to leave at a certain time. You know, it's to the level of your care, and it's at your own pace.
So why wouldn't that center in Norwood that you're talking about be the one? Or are you now telling us maybe that's where it's going to be? Or what is that missing from being what you really envision?
Right. So the Miriam Clinic, again, as I said, is a start. And Myla Flores has been amazing. She rolled out the womb bus 2 years ago.
Yes, I think we
which
have
is
a
great.
picture too.
Yeah, the womb bus is pink. It's beautiful.
I saw
we love
that.
it.
I was like, wait a minute. What?
Look, there we go.
At first I thought it was Wombus, but
Yes,
it's womb bus.
bus.
Of
Yes.
course, that makes a
and
lot
we were
of sense.
probably near Foster Park in the concourse area. I remember when we rolled that out. And what I love is that it travels. It's mobile, right? I love mobile units. But the Miriam Clinic, to me, is a start. I want to build capacity so we can serve more women. It's small. The space is small. So we're modeling that as an example. But the birthing center will obviously be much larger in size so that we can increase capacity.
You talked about funding and monies. One of the items that is in your report is expanding and increasing Medicaid reimbursements. This is obviously a very large national question. I don't know how you can get your arms around it now, but talk about the imperative and what it is that we need to do.
The imperative is that doulas have been doing a lot of work serving their patients from the beginning of pregnancy all the way to delivery, and they've not been paid fair wages. There is inconsistency when it comes to the Medicaid reimbursement process itself. Understanding that many patients are Medicaid eligible and they are Medicaid recipients. All of the changes that we've seen, I will acknowledge that there has been progress, and thanks to the leadership of Governor Kathy Hochul and so many of our legislative leaders in Albany, who are mothers themselves, we were able to get an increase in the reimbursement rate. And again, we learned all of this through talking to the credible messengers, to our birth justice defenders, right?
Birth
advocates.
justice world.
Yes,
Here we are. We've
because
entered a new world.
we are defending justice, right?
That's it.
And when you look at it from an equity lens, you see the inequity. And that's why I love when we say birth justice defenders.
In the report, it says that in a traditional birth, and this is a number, I mean, I have 2 children, I can't even imagine, costs $14,000 to have birth in a hospital. In a birthing center in the United States, it's from $3,000 to $4,000. That's a pretty big, quote unquote, savings. You also talked in the report about city and state funding, increasing public funding. You've been in elected office for a long time. That's a thorny issue, especially now. How do you see that? And is there yet support for these kinds of things in Albany and, of course, with your former colleagues in the city council?
Well, I would definitely acknowledge that there is an appetite and there is room to grow. I will acknowledge that a lot of our service providers are getting funding from government agencies, whether it's Department of Health and Mental Hygiene, agencies at the state level. It's never enough. I will say that Mayor Eric Adams and Council Speaker Adrian Adams have been talking a lot about maternal health. So has Public Advocate Jamani Williams, where we've done more to make sure that patients understand their rights and what they're afforded. But we've also allowed a space where organizations can get more funding, like the Northern Manhattan Perinatal Network. So many organizations that are serving clients and patients on the ground today. And again, you know what they do? They make $1 out of 15 cents because they are not given a sufficient amount of funding. That's something that we struggle with. And in this climate, of course, I worry about federal impact, because we can get money from local government, we can get money from the state in Albany, but if the federal government starts to cut us, it's a domino effect. And it goes through Albany and it comes down to the city of New York, and that affects our women in the Bronx.
I'm thrilled because we have the borough president here, and I'm going to move to a couple of other
Okay,
subjects,
sure.
but I want to just have you summarize.
Birth justice.
Right, there you go. You see? So what's the message to women who might be expecting right now, and then in the long run, the message to the people of the Bronx for this whole concept?
My message to women who are expecting right now is if you would like to experience a birth worker, doula, or midwife, please reach out to us. We will connect you with a licensed doula who will care for you, who will help you during the course of your pregnancy, and we will give you that real patient-centered attention that you need and deserve.
And
you
might not be getting from somewhere else.
Yes,
we
yes,
did
yes.
the justice thing. We get it.
Absolutely, absolutely. And then for the future, we are looking at a new space that we want to identify. I have committed that I will support it with capital money from my own capital. This is very important to me, not just because I am a female, but because I see the inequity and I want Bronx mothers to know that we care and we see you. And sometimes you don't always feel your best, but I want you to know you're worthy, you're loved, and you're sufficient. And if you need help, we're there.
Hard sell to colleagues in government? Not yet?
Not yet.
All
No.
right. Stick
There's
around.
a lot buy-in.
Stick around. Okay. Look, there was a story in the Bronx Times about health bucks and hunger and employment. You know, again, that's another whole justice thing. Talk about your efforts in that realm.
I saw the article, and of course, it bothered me a little bit because it's just a reminder of the challenges we face. But I do want to acknowledge the great work that is happening on the ground. I would never take away from organizations like Bronx Works and so many others that are serving clients in food pantries, soup kitchens. We're doing food equity work, food justice work, right? We are giving out health bucks at farmers markets, green markets, and farm stands. We're working with farmers. We're working with organizations in the South Bronx, City Meals on Wheels, Sharing Excess, Misfit Markets. So many organizations. We have community fridges, but yet all of that, families in our borough are still hungry, and we need to do more to access healthy food, healthy choice options, produce, and we also need to make sure that families are applying for government assistance programs because, again, you see the threat on these programs when it comes to EBT, when it comes to, you know, just supporting families, the WIC program that matters, you know, eggs are high. Everyone is feeling the brunt, and sometimes what happens, the healthy food choices are no longer an option because they're too expensive. So number one, we have to make them accessible, and we have to make them affordable.
And for anybody who doesn't think that it is a big problem, and it's not just for people who, you know, are homeless, let's say, I have been to the Friendly Fridge that's at the 242nd Street stop on the number 1 train, and you watch people who are working people get off the train and go over to the Friendly Fridge because they need a little assistance for food for their families. And you can't see it right now, but the borough president's face just dropped when I mentioned that. It's difficult.
People come to me as well. They're working and they'll say, Ms. Gibson, thank you for your food distribution. It helped me because this week I didn't know how I was going to get my next meal. Or I have an event and a young child comes to me and says, Ms. Gibson, can I take some of the food home for my sibling? That's heartbreaking. But I'm so thankful that they're asking. Because not everyone has the strength to say, you know what, I need help. Or stand on a food line, a food pantry line. So I'm grateful. And anything that anyone needs, they reach out to us. We'll get you health bucks. We'll connect you. I don't want anyone in our borough to feel like there's not help out there because there absolutely is.
I'm going to ask you a question now that's been in my mind since January 20th, and you know what date that was.
Okay, yeah, okay.
I know. This whole, and I never used the phrase DEI, but I think about it in terms of our borough of the Bronx and all the programs I've done. And every single organization I've had, you just name some of them, whether it be WEDCO or Bronx Works or any of the other wonderful organizations, every single, and it doesn't matter whether it's the business people I talk to, everybody I talk to in the Bronx, without having to say it, we have in our DNA the notion of, well, we always want to help, for want of a better term, people of color, people who are immigrants, et cetera, et cetera. I don't think if let's just say whatever the federal government is doing to, you know, Louisiana or Nebraska, if they were to come to the Bronx and say everything with DEI is out, it wouldn't compute. It's part of our DNA that this is what we're about. That's my own theory. I wonder if you would just comment on what you see out there in relation to this beautiful, wonderful, diverse, incredible borough of immigrants. All our families came from other countries. I'm sorry,
right.
that was Gary on his soapbox. But I'm curious, Madam Borough President, about where the Bronx, it's almost like an island, even though we're connected to the mainland. What do you think?
Well, first, I think that as a borough, we don't need to be told about DEI and policies that we should enact.
That's exactly
because
my point.
That is exactly who we are. We are a beautiful mosaic of different cultures and diversities and skills and professions and talents, and we all come together because we're all one. It's sad, though, because DEI and affirmative action and many of these protected programs were established because people don't think like we think. And so you have to put in mandates to establish a criteria and a standard for what you expect to see in workforce. And it's been really disheartening and really disappointing to see what has happened from this White House administration, and especially knowing people that have been outright fired and terminated at Social Security Administration, U.S. Department of Ed, and the VA hospital. My uncle is a veteran, and it's been very heartbreaking. And this is just the beginning, Gary. We're only in month 3. So again, DEI for me is the foundation of who we are. It is the floor and not the ceiling. And to every corporation that has decided to now follow suit and follow this administration, it's really shameful. And they're doing it because the administration will be punitive. So you're saying that I can't diversify my staff, which is what I absolutely want to do, because my customer base is diverse, and we want to make sure we maintain that because it's the right thing to do, and now you're going to penalize me and threaten to withhold funding? That's not acceptable. And the ones that fall victim to it are the ones that, again, I don't necessarily think that they don't believe in DEI. They just don't want to be cut in funding and be, targeted by the administration.
On that note, we love the borough of the Bronx.
Yes,
and
we do.
Thank you so much.
DEI all the way.
There you
That's
go.
right.
Thank you so much, Borough President Vanessa Gibson.
Thank you.
And we appreciate your time and your
you.
passion for our borough. Thank you so much. And we thank everybody. Our producer, Rebecca Hemick. The director is Will Guzman. Urelis Encarnacion on graphics. Ian Neville on audio. Editor is Yessie Diaz. We have a cast of thousands with us here in the studio. And you too, the most important, as she will tell you, it's the people of the Bronx. So if the curtain don't fall and the creek don't rise, I'll be here next week. Good.